guest for tonight, Secretary from the Ministry of Information, Communication and Economy, Patricia, and your colleague Kanunga, the Country Director for AIDS Healthcare Foundation, my brother, Dr. Kinyanjui, the Executive Director for NEFAC, Otoma Nelson, the representative from my brother Mulwa from NASCOP, Dr. Imbuki and your team, the Stop TB champion, Evelyn. I also saw Dr. Koech, she was here from CF, and the heroes and heroines for tonight, the members of the Fourth Estate, as well as our other partners who have joined us, and most importantly, the communities of people infected, affected, or at risk of these epidemics that we are talking about tonight. Good evening. Good evening once again. Allow me, just before I make a few remarks, to recognize the team from NSDCC that is here tonight. Also the team from NASCOP. I realize that Imbuki only recognized Kiplagat and from Nairobi County and my brother here. But all of us from government, let's stand up and be acknowledged, especially from the Ministry of Health. Please. I want to applause. Thank you. Thank you very much. They had written for me a speech. Nowadays, they write for me speeches. But this one here is the one who wrote. But I did not come on the stage with it. I left it on the table because I want to just say one or two words from my heart, just to demonstrate what we think is the importance of this evening. Ladies and gentlemen, it's a fact that the HIV response in this country has evolved and has grown in leaps and bounds over the last 42 years. And testimony to this, I just want you to look at me and also look at your neighbor. Look at me and look at your neighbor. Right? Right in the eye. Don't they look beautiful? Don't they look, I don't want to use the word yummy. Don't they look nice? That is how a person who is living with HIV looks like. You get what I said? That is how a person who is living with HIV looks like. Can you tell it from the eyesight? Can you tell it from how beautiful or how handsome they look? Can you tell it from how light they look? By the way, I noticed something with the men around. When some people of the opposite gender came to stage, they took out their cameras. But now I'm not seeing anyone taking out a camera also to take my... And the people who are taking these cameras, they know themselves. I even saw Tuoma, after everybody said leave the stage, after the MCs told them leave the stage after the award ceremony. He stayed on the stage. Did you see? Yeah, so this is courtesy of a robust program that did not exist in the 1990s. In the 1990s, if you wanted to know somebody who is living with HIV, when you went to a restaurant, you ordered your cup of tea, and somebody in some corner had a cold and a cough on that day, had a flu, and maybe by genealogy they were predisposed to be on thin frame. Mtu mkonde. Sasa mtu akikoa tu hivi na nini natoka makamasi, mtu nasema kameenda. So you get out of that hotel and you go to the next hotel because even you cannot trust the dishes that were used in that hotel. When somebody was diagnosed with HIV, they became ostracized from the rest of the community. For the young people who are here, you never saw that. You never saw people being buried like the people whom you saw being buried due to COVID-related deaths. That is how HIV was stigmatized. You could be given your own Simba, your own house, far away from the rest of the people. Your food is put about 50 meters away. Nobody wanted to reach near you because it was a virus, a condition of lack of knowledge, uncertainty, pain, name it. It was a condition basically that predisposed one, or that was thought to be the point at which you are almost departing from this world. It was almost like a sentence of death, just like the speech from Mulwaya said when we were watching him on the screen. However, because of the government of Kenya's efforts, because of the partnerships with our friends from all over globally, particularly the American government, the Presidential Emergency Plan for AIDS Relief that came into being in 2003, and also the Global Fund mechanism against HIV, AIDS, tuberculosis, and malaria, and the investment that partners such as AIDS Healthcare Foundation have put. Today, we are proud to say that we have put over 87% of the people, actually over 90% of the people who are living with the virus on treatment, and 87% of them are virally suppressed. We are not, however, blind to the pain points. We are not blind to the misses. And as Kinyanjui said here, we are losing our children. We are losing sight of where our children are found. We are losing sight of the mothers carrying those babies. Fourth ANC today is about 60%. That means 40% of the women who are pregnant do not get a point of entry through antenatal care so that they can be tested, and if they are found to be positive, they are put on treatment so that they do not vertically transmit the virus to their children. 40%, because if you do not go for the ANC clinic, then mother-to-child transmission will still be on high in this country, and that's why last year we recorded a mother-to-child transmission rate of about 8.4%, whereas we are aiming at sub 5%. So we have still not controlled it. And if you look at the drivers of this mother-to-child transmission, most of it is actually around stigma. We did what we call an early cascade gap analysis, asking ourselves, where do the people who have not been tested and are not on treatment, where are they found? And we found that in the northern frontier counties of this country, in the counties of Marsabit, in the counties of Garissa, in the counties of Mandera, in the county of Wajir, in the county of Laikipia, in the county of Kericho, in the county of Nandi, in the county of Busia, and in the county of Kilifi. That is where we have those. So you can see almost half of the counties where we have the highest gap of people who do not know their status is in the counties where hitherto we had a low burden of HIV, and therefore we did not have any programming for HIV in those counties. So for those journalists, for those reporters, for those editors who are reporting from those areas, please, this is news for you, that the counties are now turning red. That's a point of focus for us, so that we can find the 103,000 Kenyans who are living with the virus, but we don't know their status. Because 94% of the transmissions are basically due to the fact that you are not virally suppressed, you are not on treatment, and therefore you are passing the virus to your partner, or you are passing the virus to your children. So help us to find those people where they are. So we have work to do. Previously, in those areas, and I want to use a term, I don't want to be quoted, I know you are media, but today we are here to celebrate, so don't report me on the news that the CEO used this term. Previously, we were used, if you were in those northern frontier counties, they said that the HIV virus ni virus ya nywele ngumu. Ukweli ama uongo? Now nowadays, what have we done? If you listen to our agenda to Singapore, we are opening roads. Are we not opening roads? The road from Modogashe is going to where? Modogashe? See you complete. All the way, si ndio? Hiyo barabara inabeba binadamu ama inabeba mahindi peke yake? Where does the HIV virus survive? In human beings, isn't it? So as we enjoy the ride from Isiolo to Marsabit to Moyale, because you can crisscross that road in 5 hours, something which before you were taking 3 days to cross. As you take iFly from JKIA to Wajir, and you are there within 1.5 hours or 1 hour 15 minutes. As Garissa expands their lounge to make it VIP so that, and expands their runway so that we can fly there faster, we can be more comfortable flying there. What we are doing is that we are opening up those places that do not have a burden, a high burden, and we are going there, we are socializing with the people of those areas, and as men socialize, they also develop sexual contacts, and the viruses are now moving toward that side. So with development, there are also challenges that come with it. There are cons of this, which we must address. And these are the issues that we want the media to be able to cascade for us, to be able to progress the conversation for us in those places where we cannot ordinarily be on a day-to-day basis adequately. Number 2, we are also leaving behind a group of people known as adolescents and young people, adolescents and young persons. Dr. Kinyanjui alluded to it, and that is why I requested you to look at your neighbor. Because in the early 2000s, Kenya launched this free treatment program that if you're on HIV, if you are positive, then you are put on treatment, and the government of Kenya, through our own funds and through the funds of our partners, would keep you on treatment. It costs about 15,000 shillings per year to keep a person living with HIV on treatment. That was in the early 2000s. So from the early 2000s, 2005 is when now people started living longer with the virus and not developing what Kinyanjui referred to as advanced HIV disease. As a result, you cannot be able to tell. So the young people who are here, somebody who was born the year 2005 or 2000 is today about 26 years. At 26 years, they have never seen somebody living with AIDS. They have never seen somebody living with advanced HIV disease. So they do not relate with this virus. They do not relate with HIV. When you talk to them about HIV, it is something that they cannot feel, they cannot see, they cannot, they cannot fathom, they cannot understand. As a result, if you go to the pharmacist in town, on Monday morning, hardly will you find levonorgestrel. P2, you will not find, it will be out of stock. Because these young people are engaging in sex, and a lot of sex for that matter, and it's unprotected. And we have evidence to that. When you say that in 2025, the country recorded 236,000 cases of pregnancies among children between 10 and 19 years. That's an average of about 660 per day. Between 10 and 19 years, 660. Come and overlay that with the number of new HIV infections or the proportion of new HIV infections that we are seeing among that age group. 41% of the new HIV infections that we recorded last year, 41% among the adults, 15 plus, 41% of them occurred among children, among adolescents and young people aged between 15 and 24. 15 and 24, 41%, almost half. So that tells us that we are having a disproportionately large number of young people getting infected. Now, the language we speak, the language Otuma, the language Kamau, the language Kinyanjui would speak is not the language the young people speak. So you young people who are in the media space, you young people who are TikTokers, that's why I'm very proud of you, Levi, and your team, Kina Cleopatra. I'm very proud of you. Because you are able to speak a language which the young people will understand. They're able to relate with you. It is very difficult sometimes for me to speak to my 18-year-old girl, to my 14-year-old boy. They call me an oldie. You know, I'm only about 47 years. So me, I wonder, but no, I'm turning, I think, 48. So I don't think I'm old, but they call me old. So they want to talk their own language. So we must get away of the media helping us in this space of communicating with the young people. Thirdly, we have a group known as the key population. Key population is another group that we normally have stigma talking about, but from a service delivery perspective, for us, it's very important that we talk about them. Key populations are people who are at a higher risk than the general population. The prevalence among the general population is 3.22%. The prevalence of the virus, 3.22%. But the prevalence amongst the key population is noteworthy. People who inject drugs have a prevalence of 9%. HIV prevalence among people who inject drugs is 9%. That means it's thrice the one in the general population. Number two, people who identify themselves with a different gender than the one which was attributed to them at birth, transgender people. Prevalence amongst them is 22%. 22% is almost 7 times higher than the prevalence in the general population. Prevalence among men who have sex with men is 19%. That means almost also 6-7 times higher than the general population. Prevalence among female sex workers is 28%. It's almost 10 times higher than the general population. Who are the clients of these female sex workers? General population, isn't it? So if we do not program for the female sex workers, what will happen? If we don't give condoms to the female sex workers, what will happen? If we don't give lubricants to the female sex workers, what will happen? The prevalence of 3.22% will become 5%, 6%, 7%. Okay? So when we go to our community and we are programming and we find people saying that NASCOP and NSDCC are promoting homosexuality, that they're promoting ushoga, they are promoting ukahaba, we are not promoting. If you read the Constitution of Kenya very carefully, Article 1 says that that's the supreme law of the land, and it binds both all of us as Kenyans. Article 43 calls upon us to provide the highest attainable standards of quality healthcare to all Kenyans without discrimination, isn't it? So when we are offering those services, we are not offering them those services to promote. We are offering those services so that we can save, we can stop a new infection. And that is how we'll end AIDS. And Pauline, for us in Kenya, we do not have a doubt that it's possible to end AIDS. It is possible to end AIDS. We know the science, we know where the pain points are, we know where the misses are. Otherwise, we would not have been able to reduce new HIV infections from 94,000 in the year 2005 to 13,000 last year. In just 2 decades, we have reduced from 94,000 to 13,000. That means it's possible to get to zero. And that's what the media must help us in this last round. Lastly is the issue of stigma, which we want media to assist us. Stigma is what makes people do not go for tests. Stigma is what makes that girl who is a tailor in the supermarket, when you're going to buy condoms, all of a sudden, the cash box refuses to open for your change. Have you noticed? You go and buy bread, you go and buy flour, quickly you get your change. But when you go and buy condoms, the cash box refuses. Your condoms are there, she goes and calls that guy who has a special code. and that takes you That takes you, everybody's looking at you. I'm winding up. That everybody's looking at you. Everybody's looking at you. That is stigma. You are stigmatizing, and these are prevention commodity. It means life and death. So we must talk about it. One time, I was working in the county government, and I've told my colleagues this. Kinyanjui, by the way, and I used to be chief officers in the county government. So one time, and I also used to be a waziri in the county government. I was called waziri that I was a big man. So one time I go, it's a World AIDS Day. I say, let me go, and I took the World AIDS Day near my local village. So I go, and I say, I'm going to buy condoms, just to test the level of stigma. So there, those village shops, you know, the owner of the shop stays behind. There's a small window. The guy who's selling or the girl who's selling is at the front. So that box is for change. So this guy, I went, and it was 9 o'clock in the morning on a Monday. And I ordered for a pack of 2 trust condoms. It was costing, I think, about 120. So I gave 200 shillings. So when I gave 200 shillings, this girl has to give this guy the change. And I said loudly that I want a pack of 200, not 200, two condoms. So I gave the 200. So the gentleman, instead of giving the change through the window, he walked majestically to the front, whistling, wanting to see, who is this? Monday morning, 9 a.m., 2 condoms. And I was dressed in a suit. This is a man who knows me. He knows my family. He knows my father. They are church elders in the same church. We are Seventh-day Adventists. So I was a topic of discussion the following Saturday in church. All right? But of course, I went and talked about it later. That is the level of stigma that we have. And it's the one which is killing people. So I call upon you, journalists, writers, editors, please, let our pens write. Let the cameras click. Let the video cameras roll. Let us write the stories. Let us synergize. Because this last mile needs everybody. The new infections are not taking place in the health facility. They are taking place in the community. And in the communities is where we want you to assist us. So we are ready. As NSDCC, we stand committed. We stand resolute that we will walk this journey together. For the 99 who put in the applications, we say thank you. For those ones who have won tonight, congratulations. And may we see you again next year. Asante sana, God bless you.